Hi there, this is Dr. Justin Marchegiani here, and today's talk's going to be on the acid and alkaline myth. There's a lot of people out there that think you have to be alkaline or you die, right? The old book title there. And again, most people are trying to eat to make their pH, whether it's salivary or urine pH, more alkaline. So let's kind of review some of these concepts with you here. So what is pH? Well, pH stands for potentiation of hydrogen, but I mean, what that is, it's really a logarithmic scale on a 1 to 14 gradient. Let's break that down. So 1 is going to be purely acid. So we have acid on the one side. In the middle, we have our neutral. So neutral would be something like water. Water would be neutral. There's lots of alkaline waters out there that are maybe 8 or 9, as you can see. And then we have pure alkaline on this side. Acid 1 through 6, neutral at 7, and then alkalinity, again, 8 to 14. And each level you go up. So when you go 1 to 2 and 2 to 3, each increment is 100 times more. So a pH of 1 is 100 times stronger than 2, and etc. So again, we have various pHs in tissue. So a lot of people are under the assumption that we have to be alkaline, but the question is where? Because we know, for instance, in the blood, 7.35 to 7.45 is the pH. It has to be at that level. If not, you will actually go into a coma and potentially die because of the fact that our body is so enzyme driven, and enzymes are activated by pH. So let's review that concept. So for instance, in the stomach, our pH has to be super low, between 1 to 2, maybe 3 at the highest. We need it to be super low. Why? Because hydrochloric acid is produced by the parietal cells in the stomach. Hydrochloric acid's job is to activate pepsin. Pepsin is a proteolytic enzyme, mainly to break down protein. Hydrochloric acid keeps the gut sterile. It prevents outside critters from coming in, so it keeps the environment nice and clean. And again, if the pH starts going higher and higher in the stomach and moves towards being alkaline, well, you're going to have a lot more dysbiosis and bacteria. And if our pH isn't low enough, that esophageal sphincter clamps down based on pH. The lower the pH, the more the acid, the more that esophageal sphincter closes down. If it doesn't close down, guess what happens? The food in your stomach rots, and that pH of the organic acids, that low pH organic acids, the rotting of that food will rise up, and if that esophagus isn't clamped down, they will rise up and it will reflux, so gastroesophageal reflux disorder, and it will burn the lower part of the esophagus because the esophagus doesn't have that protective barrier that the stomach does. So over time, you'll have a nice thinning of the gastric lining if you don't have enough pH in there. So again, the stomach has to have a lower pH. The adrenals have a lower pH. You're producing, a lot of these hormones are acid-based. Urine, typically a lower pH. Colon, a lower pH. Now we look at some other cells or some other tissues in the body that are more alkaline. For instance, the small intestine, all that chyme. So chyme is just mixed up bolus of food. So all the food that's kind of mixed up and ground up in your stomach with all the different enzymes and acid, that food is very acidic. So as that chyme or that ground up food goes into the stomach, into the small intestine, it needs to be acidic to trigger the pancreas to produce enzymes and the gallbladder to produce bile salts. So if it's not there, then we're not going to have that trigger. Well, what's also produced is bicarbonate by the pancreas, and that brings that pH up. It brings it up so we don't have that burning in the small intestine. So the small intestine's pH is actually a little bit higher. The bile salts that are triggered from the high stomach acid is actually going to be more alkaline. So we have the stomach, low pH, into the small intestine, much higher pH, and then as we go down into the colon, it goes low again. So you can see it like this. Stomach, the pH is low, about 2. Goes to the small intestine, pH of about 8. And then it goes to the colon, pH of about 5. So you see this low to high to low type of pH range, and that needs to be there for optimal digestion. And you can see other tissues in the body. So for instance, the interstitial fluid, the fluid between the various cells, is more alkaline as well. So let's talk about some foods. So we have sugar tends to be more acidic. We also have grains tend to be very acidic, typically around a pH of 4. Right? We have meats tend to be between 5 and 6 on the pH scale, so on the acidic side. And then our vegetables tend to go on the higher side, 7, 8, 9, depending on what vegetables we're talking about. I'll flash a nice little pH chart on the screen so everyone can kind of see what foods fit in each category there, so you'll be able to see that. Now this is important. Our body has systems and ways of buffering pH. So a lot of people think, well, how much of a difference is it really going to make if I eat more alkaline foods or eat more acid foods? Problem is, Weston A. Price, he's a anthropological researcher, he was a dentist, and he spent 10 years of his life visiting various tribes. And there were some tribes and some cultures that ate very acidic foods. So the Maasai was one tribe that ate grass-fed cow's blood and grass-fed milk. So very, very acidic diet. The Inuit ate primarily 90 to 95% fat, whale blubber, high meat, high fat diet, and both had phenomenal diets and phenomenal lifestyles and phenomenal health. It was when the introduction of processed foods, that's where their health tended to go south. So we have these cultures that didn't eat these alkaline foods, they barely ate any vegetables at all, if any, and they had great health. So we know that there are systems in the body that are designed to regulate pH. Now, I'm from the belief that you should have some vegetables in your diet, and some people will do better with higher meat, higher fat, and lower carbohydrate. Other people will do better adding in a lot more vegetables. So I typically do about 1 to 2 fists of vegetables per meal. And I kind of dial in my meat based upon how hungry I am, where I am in my workouts. If I've already worked out and I need to replenish some protein and some amino acid stores, yeah, I'll have some good serving of meat afterwards. So it really depends upon your activity level as well as your metabolic demand. If you have metabolic damage from diabetes or metabolic syndrome, maybe to keep the carbs up and the fat and protein higher to keep the blood sugar more stable. But here's my biggest issue. Tissues in the body, some of the most vital foods, vital nutrients, vital parts of our body are acid forming. So we have DNA. DNA is deoxyribonucleic acid. We have fats, which are fatty acids, right? Eicosapentaenoic acid, EPA, DHA, docosahexaenoic acid. That's the main fat that our brain's made up of. We have vitamin C, ascorbic acid. We have PABA, another nutrient, B vitamin, para-aminobenzoic acid. GABA, gamma-aminobutyric acid. Protein, like I already mentioned, amino acids. So we have a lot of nutrients that are really important that are acid forming. So are acids really that bad? Well, we have systems in the body that are designed to regulate that. So for instance, we have our acid-base homeostatic system. So homeostasis means the body trying to kind of get to this so-called equilibrium. So let's look at how the body does that. So we have the ability to convert H2O and CO2. So the body will excrete CO2 via the lungs to control acid. So CO2 is more acidic. So if we breathe deeper and more vigorously and increase the amount of frequency we're breathing, we're going to decrease acidity with increased breath. Why? Because we are expelling more CO2. Also, our kidneys are involved too, because here's the CO2 here, right? So we have H2O and CO2. So the body can then take this CO2 and increase its expulsion to the lungs. So we can increase CO2 by breathing more, increase deeper breath, increase breath. Our kidneys also have the ability to take this H2O and CO2 if we want. We can make it or bring it together and make carbonic acid. That's carbonic acid, H2CO3. And then we can create something called bicarbonate. Bicarbonate is alkaline, similar to baking soda. And our kidneys can then excrete bicarbonate right here, and that will also raise the pH as well. That will decrease acidity as well. And again, our body can very simply slow down the breath. By slowing down the breath, we're going to increase CO2, right? We're going to increase CO2 in our body, and that will also raise the acidity again. So we have homeostatic mechanisms. We have the ability to produce more bicarbonate in the kidneys. That will make the body more alkaline. We also have the ability to excrete more CO2, which will make it more alkaline as well. And then also the opposite. We can hold on to more CO2, that will make it more acidic, and we can secrete less bicarbonate, and that will make it more acidic as well. Now we have other systems too that a lot of people go to first when they think about acidity and alkaline. They think, oh, well, we're gonna leach minerals from the bones, right? We're gonna leach magnesium or calcium, or we may leach more potassium from the tissues. Again, this tends to be the last place the body will leach these things from. But again, you can use potassium and magnesium in supplement form, and you will see that your morning urine does go up. In my opinion, you're just spilling over those extra nutrients and your body's excreting those alkaline compounds in the urine, so then yes, it will make the urine pH up. Also, I've talked to doctors that work at cancer centers, and one of the things that they see at cancer centers is that a lot of the cancer patients that are really sick, their pH is actually more alkaline. Now, why is that? The theory is that their pH is more alkaline in their urine is because of the fact that they're excreting, they have the inability to excrete the acids. So the acids are accumulating inside their body and they're not able to excrete those acids. So another mechanism is also the kidneys excreting the various acid byproducts, getting rid of those acids. So most people look at the blood should always be there, but they'll look at typically either the urine or the saliva as a means of what their pH is, but their body may be excreting those acids via the urine, and that's why the pH is lower. Also, a lot of women that I see that get urinary tract infections, the reason why they do so is because their urinary tract is more alkaline. That's one of the side effects of birth control pills. Birth control pills will actually make the urinary tract more alkaline and make it more hospitable for bacteria like E. coli or Gardnerella for bacterial vaginosis infections. So that's why one of the big things we see is what? Cranberry juice that's more acidic will actually lower the pH. Even probiotics, right? Lactobacillus acidophilus stands for acid loving. So probiotics will actually produce various acids. Those acids will lower the pH and make it more inhospitable for the bacteria to live. So recap here, pH, right? 1 to 7. Between this area is going to be your acid. Between here is going to be your alkaline. Logarithmic scale, 100 times for each increment. The foods that are going to be your lower pH are going to be your grains by far and sugar by far. And then progressively, we're going to see the meat and the vegetables go more and more alkaline. I'll put a chart on stage here for you. Again, pH in the tissue, we kind of talked about the up and down effect of digestion, lower in the stomach, higher in the small intestine, lower in the colon. And we talked about the ways the body can provide homeostasis for the pH, right? Kidneys can produce more bicarbonate, lungs can expel off or hold on to more CO2, plus the kidneys can also excrete ammonia and urea and various compounds from protein digestion or inflammation. So I hope this video was helpful. pH isn't all it's cracked up to be as a marker of health because our body can do so much to regulate it. My suggestions are eat lots of vegetables, figure out what dose of meat is best for you, make sure it's high quality meat, make sure you're drinking enough water so your body can use the kidneys to flush out the various acids. And again, good magnesium support tends to be helpful because it's one of the most deficient nutrients in our body and it's also very alkalizing too. Thanks, this is Dr. Justin signing off. Subscribe below for all my video series and more videos coming your way right away. Thanks.